It's on now. Welcome to our session, Voices for Change, the Chef Fellowship in Action. We're excited to spotlight the transformative work of the Climate and Health Equity Fellows, who are a group of physician leaders dedicated to driving solutions at the intersection of climate and health equity. This fellowship, which was founded in 2021, has educated fellows across the country from Florida to Hawaii, equipping them with the tools to advocate for policies that protect the most vulnerable and advance health equity. We want to thank our tremendous sponsors and partners for their support over the years. And we're especially excited to announce that we have just launched our 5th cohort, many of whom are sitting in the audience. These new fellows join our growing network of nearly 40 physician alumni across the country. And today you will hear firsthand from several of these fellows about their work, the communities they serve, and the bold steps they are taking to shape a healthier, more just future. This session is not just a discussion, it's a call to action. So let's dive in, let's learn from their experiences, and discuss how we could all be part of the movement for climate and health justice. Our first fellows are Dr. Marcus Iwane. Dr. Marcus Iwane is an internist from Hawaii, and he's a Chef 2023 graduate, and Dr. Martina Kamaka, who is a 2024 Chef graduate, also from Hawaii and a family physician. Welcome.
Aloha kako. I'm Martina Kamaka, as you heard. Marcus and I want to first disclose we have nothing to disclose. And we're going to start off with a traditional introduction. So my name is Martina Lealoha Kamaka. I'm the daughter of Frederick Ku Kamaka and Elizabeth Louise Talon. I hail from the beautiful Aina of Kaneohe. It's the Ahupua of Kaneohe, down here below the Ili of Haleko. My mountain is Lanihuli, my river is Kamo'oli'i, my rain is the Apuakea rain, and my wind is the Ulumano wind.
Aloha kako and aloha aina, mai kalahi a kalakau, o Marcus Iwane, ko uinoa, o Ulupalakua, ku aina kulaiwi, o Waipio o Ahu, ku one hanao, and o Waimalu o Ahu, ku aina ho'okama. So aloha all. The top picture is where my ohana, my family is from Ulupalakua, Maui, overlooking the island of Koho'olave. Koho'olave is a very special island for us as Native Hawaiians, and we'll kind of share a little bit about this and why it's so special. But first, we'd like to honor one of our kupuna, our elder, Dr. Noah Emmett Aluli. Dr. Aluli is a family physician, but he is also Aloha Aina warrior. Really someone who advocated on behalf of Native Hawaiian health and how important it is for us as Indigenous people to connect to the health of our land. He was also one of the driving forces behind stopping the bombing of Koho'olave, the island that was seized by the U.S. Navy at the onset of World War II as a target and bombing practice. So, you know, Dr. Aluli was an inspiration. He's been a mentor for a lot of us, including myself and Dr. Kamaka. And as Native Hawaiian physicians, you know, we really hui up, we really gather together to share the importance of how it is for us to understand history and how history plays into our everyday health and wellness. So we actually have 3 chef fellows, graduate. Dr. Mahealani Lam completed her chef fellowship in 2022, myself in 23, and Dr. Kamaka in 24. So before we kind of talk a little bit about our projects per se, I'd like to take you guys back pre-contact to 1778 when Captain Cook first arrived on the shores. So what he did was he really captured some very unique and remarkable things about our society and how Native Hawaiians really had a sophisticated public health system. So this is a depiction of what we refer to as an ahupua'a, or a land division that spans from Mauka, so up mountain, all the way to Makai. Everything in between that was said to sustain enough resources for life. And so through the years, colonization has really shifted us away from the shared resource model and really impacted our health and wellness. You're talking about marginalization, colonization, and changes in land use. So water diversion, for example. And all of this has really impacted our health and wellness to today, as research suggests, is a major contributor to health disparities in Native Hawaiians. And we know that environmental justice is really the latest thing that Native Hawaiians must overcome. Many of you have seen a slide similar to this. This slide was adapted from the CDC pinwheel on the effects of climate change on our health. But what we did in Hawaii was we actually added this red circle that I like to call attention to, and how climate change really impacts us, not just physically, but mentally and spiritually. And environmental factors have a lot to do with generations. We know that it even impacts our life expectancy. So if we're looking at this depiction, this slide of Oahu, you see there's different areas in yellow, blue, green, but calling attention to that area on the west side of Oahu that's circled in red. So that is on the Waianae, Ahupua'a, that just so happens to have the largest concentration of Native Hawaiians in the entire world. But if you reside in this zip code, your life expectancy is actually 10 to 12 years less. Now, the island of Oahu is not a very big place. So you think about it, right? How can your life expectancy or how healthy or long you live depend on where you come from, even if it's just a 5-mile difference? So really understanding the impacts of our environment on our health is important, especially for healthcare systems. So for me, I'm a physician at Kaiser Permanente, and part of my capstone really focused on how to incorporate climate language into one of our major healthcare delivery systems in Hawaii. And so this was actually the birth of what we refer to as Kipuka Oha, which is a name for our West Oahu facility in Kapolei. So remember from that slide just prior, that zip code highlighted in yellow, circled in red. So we decided to put the best clinic with the most resources smack that in the middle of that community, which just so happens to also be the community that is the hottest and doesn't cool to the same degree as other communities across Oahu. So focusing on sustainability was a big thing for us, really kind of shifting the narrative in how we approach health and wellness, not just from a physical standpoint, but holistically, mentally, spiritually. But most importantly, what's really awesome is how we're able to incorporate the element of cultural resilience, focusing on the beauty of Native Hawaiian health, and specifically, how can we improve the healthcare of our sickest populations and most vulnerable? So besides technology, besides incorporating sustainable features in this clinic, one of the highlights is a microgrid. So for those of us who don't know, microgrid is an energy generating system that as long as the sun comes up, we actually produce power. But more importantly, we're able to incorporate those elements that I talked to you about resilience and community partnerships. So we actually have a farm or garden on our clinic grounds that we actively manage and produce food. And what we do is we share this food with community. We share this food within our lifestyle programs, but more importantly, it's an opportunity for us to mentor. This picture on the bottom right is a picture of a young Native Hawaiian boy. And, he's holding halo, which is kalo. And for us as Native Hawaiians, this is our genealogy or where we come from. And halo is actually our physical connection to land or aina. So having the opportunity to participate, to now think about what health is about. It's not just about coming to see a physician or your healthcare team when you're sick or not feeling well. It's about resilience. It's about cultural connection. It's about health and wellness. And so all through that, incorporating concepts of aloha aina, right? Love for the land, and how important it is for us to connect our health specifically to the health of the land that sustains us. So I'll hand it off to Dr. Kamaka, because I think the highlight of why we're both here standing together is a collaborative efforts. So not only through the chef fellowship, but through other capacities, we're able to work together and put together to make a change.
Okay. Okay. So, my chef capstone really focused on education. I'm a medical educator. I work at the John A. Burns School of Medicine at the University of Hawaii. And I actually had a multi-pronged capstone. I wanted to target medical student education, which is that space where I usually work, physician education, because I was really inspired by the work that by what I was surrounded by in the chef fellowship, to really work with my physician colleagues. And then there was, you can't be Native Hawaiian in the health space and not work with community, and community expects us to do advocacy for them as well. So those were three prongs that were involved in my capstone. I want to talk first about the physician-focused one, which is, I actually did a climate change conference. It was called Aloha Aina He Huliawi Kapono. And that means to love the land and to be at a turning point for planetary prosperity, for what is right for the planet. We're at that turning point. And so I was hoping to inspire physicians to get more involved in learning about climate change and also advocating for climate change. So we had, your traditional one day of didactics, but I also had a half-day workshop. And what was very cool about the workshop is it was keynoted, or half-day, by youth that had actually sued the state of Hawaii Department of Transportation because they did not meet their climate goals, and they won the lawsuit. And I thought, I know, it's amazing. These are high schoolers. And what I thought, if our kids can do this, we can do this. So that was the idea. The other thing I did was in the morning, we actually had 2 field trips. So we're talking about, this conference really was looking at Native Hawaiian Pacific Islander health. And so connection to land was really big. Food, ocean, sea level rise, everything. But I really wanted attendees to get that feeling of what that meant to connect to land. So we had 2 field trips. One was at a 100-acre garden in the back of a valley that's connected with one of our community health centers. It's an amazing place. And the other one was actually at the Kipuka Oha Clinic that you heard about. So all the attendees could go to one or the other of these sites. And then we came back for this workshop, and we really focused on advocacy. How do you start as a clinician thinking about advocacy? What do you need to do? And so that was sort of the highlight. I managed to get 15 CME credit hours. If any of you guys have ever done a CME conference, that's a lot of work. But it was worth it, I think. But anyway, we worked with local food, had a Native Hawaiian chef. Everything was locally sourced, traditional foods, just really trying to get people to understand that connection to health. I had a medical education component. I'm the advisor for the medical students for a sustainable future at the University of Hawaii, and they wanted to do, this was right after the Lahaina wildfires, and the students really wanted to explore what happened in Lahaina a little bit more. So we were offered a colloquium, which was a 3-hour symposium, and we brought in experts, someone who'd been doing mental health with survivors, and Alika Mauna Kea, who was one of the lead researchers on the Maui West study. The Maui West study is a 5-year NIH-funded study looking at short and long-term health impacts on survivors. So we've been looking at everything and I helped to volunteer with this program, everything from pulmonary health to kidney health. We've been finding a lot of heavy metals that are still in their blood, and adverse impacts, obviously, on lungs, mental health. So the students really wanted to know about that, hear about that. But I really wanted to, at this point, talk about what we've been doing, the 3 of us, Chef Fellows, in working together and networking. I think one of the beautiful things that this program did was allowed us to network and talk to each other. So there's several joint things that we've been involved with. One of the major ones has been the Climate Change and Health Working Group at the state of Hawaii. This is a group, I don't know, we must be about 30 organizations. So we have Department of Health there, we have University of Hawaii there, but we also have a lot of nonprofits and grassroots organizations. There is no leadership by the government. This is all very kind of organic. But what we've been able to do is we've been able to hold listening tours around the island, particularly in our Native Hawaiian communities. And it's been really important for them to not only have the scientists come, because there's always a little, you always have to be a little careful with mistrust and, what do these scientists from UH want to do? But to have us as Native Hawaiian physicians show up and be there in these listening tours and listening, what is important for your community? We have all these resources that we can galvanize to help you. How do you want us to help you? How can we help you? And that's been really informative. We've presented at multiple conferences together. We also, before I get out of that, I have, with the medical students, not only had the symposium, but I've introduced climate change into our problem-based curriculum, problem-based learning curriculum. It's really hard to bring new things into a curriculum in med school that's already packed full of stuff. So the innovative or creative way to do it was to take cases that were already there and then work climate into it, and we did that. So we did in collaboration, we did some joint conferences, and one of the most interesting conferences that we've done is the last one that I'm going to have Dr. Iwane talk about, but I also wanted to let you know that we've jointly presented at international conferences, and also we were invited to talk at the Department of Health. So
Real quickly. So this is a picture on Kaho'olawe. So one of the things that we've done was we actually put together a CME event on Kaho'olawe that we call Climate Trauma and Healing. And so this was a really awesome event that we were able to do because it's multi-pronged. This is a picture of Ahahui on the Kauka. These are all Native Hawaiian physicians. And so bringing Native Hawaiian physicians to Kaho'olawe, an island, like I said, that was nearly desecrated for about 40 years. It's part of the healing, right? It's part of the healing for us as Native Hawaiian physicians, as Indigenous peoples, but it's also healing for our Aina, our land too. And so this is a really awesome event to kind of share and talk about climate, talk about health, talk about the impacts of extreme weather on our people and specific vulnerable communities. We were able to bring in some state representatives from the Office of Climate and Resilience to be with us too. So really talking about health in totality. I just want to kind of end with this slide, how important it is for advocacy. I think we don't really get that in training in medical school, right? Not even in residency. And so it's a very scary space for us as physicians. And so the Chef Fellowship really helps to expand our knowledge base and comfort in really being able to speak on the impacts of climate and health. And this is part of Dr. Lum's capstone that she did. Was one of the first things she did was really kind of inspire Ahahui on the Kauka, the Associated Native Hawaiian Physicians, to put out a statement, about our commitment to protecting our Aina, our land, our commitment to protecting ourselves as Native people. And so really by doing that, we're focusing on our health, not only as Kanaka, as people, but also the health of our land. Thank you.
Good evening, everyone. Thank you so much, Dr. Marcus Iwane and Dr. Kamaka. We are so pleased to have another Chef Fellow with us. This is Dr. Aisha Harris. She is a graduate of Chef 2024. So she is from Flint, Michigan, and she is a family medicine physician. Thank you, Dr. Harris.
Okay.
Hello, everyone. Like I said, I'm a family medicine doctor from Flint. And so I went back to my hometown after residency. And so one of the things that I enjoyed with the Chef Fellowship was I was able to hone in on my curiosity regarding climate and environmental health, but also engage my community more as far as being a resource. And so my capstone is focused on basically empowering my community. I think a lot of the things that come with climate and environmental health concerns would be strengthened if residents and people on the ground understood more and felt like they could be involved in their own protection and prevention in the long run. And so outside of Chef, I am really big into health literacy. Being a primary care doctor, health literacy is really important for my patients to be successful, but also to understand what's going on. And so in that same space, I focused on climate literacy when it came to my Chef Capstone project, because as I learned more, I understood that climate anxiety was really high in every community, that climate awareness and the impact was really low, and that we had a gap to fill, but also we had an opportunity to bring along a lot more people in our fight in the cause for climate change and climate action. And so through the fellowship, I don't know where the words went, but through the fellowship, I did a lot of advocacy in my state as well as in DC. And so I was part of the health policy cohort and in different organizations, from the Climate Action Campaign to the Allergy Asthma Day, and just speaking on my perspective and my experience with my patients and how climate and environmental health impacts them. And so as much as I love health policy and public health work, again, I really enjoy empowering my community. And so my project is focused really on Flint itself. Flint is been in the news for various reasons, but it is an environmental justice community. So outside of the Flint water crisis, it also has had its share of impact when it comes to the automotive industry, when it comes to the agricultural space in Michigan. And so there's a lot of broad things that have impacted Flint itself. And so it being an EJ community is a great opportunity for me to try and be part of the solution. Outside of the environmental concerns, Flint also has its own information gap. And so we don't know what's going on with news, with health, with anything kind of in politics. It's very hard for people to have that information just like readily available. So when I think about climate and environment, I wanted to kind of close that gap, build the awareness and close the gap with my project. And so that's where the EnviroFlint project came from. At its core is basically a resource and awareness building tool for people in Flint. It has a basic, very basic alert system that I try to develop in hopes that it could be incorporated into something in the future. But if you go to the website, it's enviroflint.com. It has information on heat, water, land, air, all these things that are impacting people's environment, getting them to learn as much as they want so people can have a superficial understanding or they can dive deep. It also has resources that I've been connected to through the Chef Fellowship that has been honed down either specifically to like zip codes in Flint or at least our county, because I really think that people care more when it's impacting them personally versus us talking about things that are happening across the United States. As much as everything happening across the United States is of concern, when it's at people's doorstep, they really feel like, oh man, this is something that I should be paying attention to. And so I wanted to not shock people and scare them, but I wanted them to be more concerned, because as a health professional, as a primary care doctor, I see the long term impact of a lot of things in health, because we know social terms health is very broad, but learning more about climate and environmental health it increases my anxiety. I'm not going to lie. Learning more did not help things, but I'm still motivated. I'm here. I'm showing up, but it's a lot out there. And so I wanted people to join that fight and for our voices to be stronger, which is why I developed the EnviroFlint. So this is kind of the screenshot of the website. It's technically housed in my own other passion project, which is the Flint Health Hub, because we don't have a lot of great resources for people to access health data and health resources in our community as far as just like a one-stop unbiased site. And so it's housed within it. It teaches people about heat, air, land. A lot of people know about the lead in the water, but they don't know about the other things that are impacting our water. And so people can go to the website, but the EnviroFlint alert system is something that is a email list right now, as well as a social media campaign. The hope is to have it really in people's hands through like a text system, but that is the long-term kind of plan. We do have an alert system within our city that needs to be rejuvenated and organized, but my hope is me kind of doing the EnviroFlint on the side will eventually make it really, really prepared for them to access and incorporate into their current alert system. But I'm not gonna lie, Flint is not that organized, so that is another frustrating thing. But I love my city, but I'm trying to be part of the solution. So with EnviroFlint, like I said, it's email subscription, it's a social media campaign. I really want to be part of the text alert system, which already exists in the city. But through this project, I've also connected with local and statewide partners and environmental justice associated nonprofits with the hope of broadening the people who are aware of EnviroFlint, but also just connecting with people with like-minded goals when it comes to addressing climate change and environmental impact. The long term of it will hopefully be not only incorporated into the system as far as weather alerts. We've had West Nile engines in Genesee County, which is the county that Flint is in. We've had oil spills within our river, and there's like random stuff that's happening that people just don't know. And so the alert system is trying to really fine tune how people are aware of this so that way they know what to avoid, what to do. As much as I want to inform people about what's going on, I also want to equip them with how to prevent it from happening again, potentially, but also how to protect themselves. We all know that as you learn more things, people are like, okay, yeah, that happened, but like, what do I do? And so I wanted to not only inform them that it was happening, I also wanted to give them the tools to protect themselves in that moment, but also protect themselves in the future so they feel like they're not just being like told a bunch of things, but also incorporated into hopefully the longevity of their community and their legacy as far as the health of their family and themselves. And that is it.
Thank you very much, Dr. Harris. We'll welcome Dr. Curley. Dr. Condessa Curley is an internist from Los Angeles, and she is a 2024 chef graduate. Yes.
So I'd like to say good evening, and I know it's the end of the day, so I really appreciate your time, your energy. Today, I'm going to talk about checking the temperatures in our neighborhood and vector ecology, the vectors, the mosquito. With the Chef Fellowship, what we did was we really learned how we could collaborate, the goal to educate. For me, it was about public health, connecting that to our community, to climate change, as well as to the vector, which is the mosquito. So it's important to know that I am medical director for clinic services in Los Angeles County, and I service the southern part of the county, and that's where we have the most disparities and gaps in care. I hope you can see the rain. You can't hear the mosquitoes, but the mosquitoes are there. So what I did was I really wanted to take a look at, oh, you hear it. It's there. All right. Good job. Good job. So as you may know or may not know, the Public Health Department, what we do is we do a lot of surveillance. Our main goal is to stop the transmission of diseases that are communicable. So I wanted to look at the vector, the mosquito. And so it was important to me to see that in the state of California, we have dengue fever. And typically when you think about dengue, you don't think about California. You think about all these wonderful exotic places and so forth and so on. We do have West Nile, but today I'm going to talk about dengue fever. So when you talk about climate health related illnesses, what we've seen in Los Angeles County is the rise of dengue fever. And so what the California Public Health Department does is that they do surveillance. And so if you look at December 2023, what we found was 78 travel-associated dengue fever illnesses. And then we only had 2 that were locally acquired, meaning that the mosquito bit human and the human was, they had a meal, bloodbath in the blood meal rather, and then the humans then were bitten by another mosquito, and then so forth and so on. So if we go further down in September of 2024, what we saw was an increase in the number of travel-related illnesses, and then we also saw an increase in the number of locally acquired. For 12/24, we're 221 travel associated and up to 14 locally acquired. And you may say, well, it's December, it's cold. Well, what we know about larvae is that they can live up to 40, they can survive in 40-degree Fahrenheit weather. And they just wait for the environmental opportunity to change so that they can continue the mosquito life cycle. So what I saw was for the environmental transmission factors were extreme weather. In Los Angeles, we went, one day was 100, the next day was 120 degrees. I mean, we were all over the place. And then we look at human activity, and by human activity, are we wearing a repellent? Are we using our clothes where we have long sleeves? Then we were traditionally taught that mosquitoes only bite dusk to dawn. But what we know about the mosquito that causes dengue, and there are 2, they're the Aegypti and albopicus, that they take food all day long. So there's no such thing as dusk to dawn, it's all day long. Now we look at land use. How does that impact the environmental changes in the replication of the mosquito? Well, what we've seen is that we are creating places where we have stagnant water. We have urbanization, we have deforestation, we have even our agricultural irrigation. We have farmland up in Northern California where we have rice paddies. And if you know anything about rice paddies, there's a lot of stagnant water. And then we have storm waters. And all of this, we know that if you just take 1 cap of water and you just leave it out, and a female mosquito impregnates that water, there's 100 larvae that can live. So what are the consequences of warming temperature? Well, increased breeding sites. We have increased host and reservoir distribution. We have an accelerated incubation period of the virus. And then we have longer seasons where it's warm means that you're going to have longer disease transmission. So the goal of my capstone was to really connect public health, the climate change, the mosquito, and our community. So I wanted to develop a tool that would educate providers and patients, make sure it's time efficient because, we only have 15 minutes to see a patient, right? And then I really wanted to help identify modifiable risk factors. And those are things that we can do, the public can do to really change the transmission pattern. So, if you look in Los Angeles and you can drill it down to exact counties and you see the red and the blue on my right, you'll see the Aedes aegypti mosquito was in red and the Aedes albopictus is in blue. And this is in Los Angeles County. If you move further along, you'll see the area that I work in South Los Angeles, and you can clearly see the mosquitoes are there, they're breeding, and they're transmitting. There's a website called Neighborhoods at Risk, and what's really interested in, I was really interested in is the no tree canopy as well as how much heat is in this area. And no tree canopy in South Los Angeles, 98%. If we talk about heat impervious areas, 73.5%. So that sets us up really to really increase the transmission as the temperatures change. So the action taken for me was that I first wanted to know, is this just a phenomena here in California? And it is not. So I did a Google map, and the Google map is a QR code there. And that tells you where in the United States we have dengue fever. And we have dengue fever everywhere. Sure, Florida, it's higher. California, it's getting there. but it's everywhere. It's amazing to look at that. And then my next step was to do a pre-exposure prophylaxis medical prescription here, where I can give this out, and I do a lot of talks in the community. So I give the prescription out to them. And the prescription reads the patient's name, the address, whatever climate sensitive conditions they have. And then I say, review the image, and the image is in the rainbow colored image there. And you're supposed to start monthly actions immediately. And the monthly actions, depending on what time of the year, it will be to when you use mosquito repellent, when you wear protective clothing, when you should eliminate standing water. And if you look at the URS code, oh, it's not on this, but also that URS code that's on this, it takes you directly to the California Public Health Department website where you get updated information on dengue. Now, this can be used anywhere throughout the United States. I work very hard with the folks that are doing this, so this is available to everyone. And so as you can see, the blue is when there's lowest risk, and as you cross the spectrum, the highest risk is in red. What I also did was to really incorporate this education in CERT training. And CERT, if you all don't know, is the Community Emergency Response Training. It's put out by FEMA, and everyone sitting in this room should have CERT training because it's emergency preparedness for us all. You can get it usually through your LA Fire Department. It's 17 hours. It's broken up nicely for those that work during the day and want to spend 2 to 3 hours in the evening to take this course. But it is really imperative that we all take that. So it's the first time that CME was, and climate change was put into the CERT training. So that was something that was a big win for us. So So, our fellowship ended in December, but did our commitment end in December? No. So right now I'm working on ICD-10, and that's billing codes for climate health billing codes, so that our providers will at least have an easy fact sheet that they can actually bill. And then I'm working with the Department of Water and Power. In LA County, we give out trees free of charge. So the trees that we give out, are they drought resistant? So now I'm working with them to look at drought resistant trees and drought resistant plants. We also were engaged in lots of informing the media. So there was an op-ed that was also done. So what I want to say is this. This is vitally important. It can be used anywhere. Anyone can use them. The prescription, it has my name as a physician, but if you're not, this is an educational tool. It can be utilized by anyone and everyone, going to churches, communities, and what we find is people like to get a handout, right? And so when you go to shelters, we had wildfire, our wildfire evacuation centers. These were places also, and you start now. This is February. You see it's blue. We're going into March. So with that, I thank you all.
Thank you so much, Dr. Curley. And we are very proud of all of the fellows and the work that they continue to do. They have not stopped after their one-year fellowship. I want to take a brief moment, if you would indulge me, to thank Dr. Maybach for his support of the fellowship over these years, his service and contribution, and we have an award for you from the Chef program. We'll do Q&A after.
Oh, that is so sweet. Thank you.
Thank you. Questions, I know we're right on time, but I don't know. I know we have mics on the side, or if your voice is loud enough, you have a question for our fellows. Dr. Holder.
Accepted or received by other clinicians? Have you tried it with other doctors and nurses?
So I worked with the company that did this, and they're hot off the press. So I got them in time for my first community outing in January. So we'll let you know. The other thing too is that we're working on one for wildfires, post wildfire prophylaxis prescription, and so that'll be next. You can make, I can give you the QR code where you can call the company and they will make it up according to, oh, it's in the process of being printed. This took about 3 months to get through all the process, but we're working on that now. If you're interested, just come see me. Thanks. Well, everything that is post-wildfire. So we've gone up and we've surveyed the areas, and what we find is that people are going up looking for their belongings. It's just heart-wrenching. And when they go up, they're walking on the dirt that has been exposed, and sometimes they don't have masks. And then sometimes people realize is that we had to mark off cars that were non-EV and EV, because we know with EV we have lithium and that seeps into the soil. So we're telling them how to go to and to get their things, what to wear, how to decontaminate. If you're going to go into a place with a certain pair of shoes, that certain pair of shoes, you take it off and you return to your car, don't take it into your home. We are telling them about things that they can do because there are a lot that are planning to build back, and ways in which they can contact their insurers to build back. So personally, what we've done is a lot of them have lost their medications, and so they're at the evacuation centers. We have physicians there prescribing for them. We've also talked to them about when they're going to their different homes and to make sure that, we just think that our suitcases and all the things that we bring with us, there's no contamination on them, but there's contamination. And it's really difficult for people to try to clean the things that are memories that, they could find. So it's a list of the do's and don'ts, and they're mostly do's that we have.
I just wanted to add to that really quickly what we know from the Maui West study, looking at the Lahaina wildfire survivors, is that as physicians, we really need to be monitoring these patients that were exposed for long periods of time. We're finding obstructive lung disease, we're finding heavy metals. We did not test for forever chemicals, but I expect that they were all exposed. So I think that's a caution we all have to keep in mind as we have more and more wildfires, is that we need to be talking to our physicians about how to manage these people over the long term and try to prevent problems and keep them as healthy as possible.
What's interesting is that they are telling us that 6 inches, going below the ground 6 inches, it's okay, that it's no longer contaminated. But we know lithium, depending on the soil, if it's like sandy soil, it's going to seep through. If it rains, it's going to seep through. If the soil is hard, then it's going to stay there longer. And to your point, that's true. There's a lot of care that we're offering them in so far as those that have the climate sensitive conditions. This is part of the climate sensitive conditions. So we refer them back and get them into care with their primary care doctors. What this is about is outreach. This is immediate outreach. So we go to churches, to communities, to places where people are. We give them to community groups so that they can feel comfortable and give this to them. And then at the bottom, it has contact information. So that's there for them. They want more.
Thank you so much to the fellows. Congratulations. Some of them have just graduated 2 months ago. Congratulations. And we look forward to the work they're going to continue to do in this space. So thank you for your dedication.